Hello everyone, I'm Scott Gregg. Today we're talking with Dr. Patrick Quacha of the Dream Dental Group in West Bloomfield in Commerce Township, Michigan, about finding cavities in kids earlier, and specifically some of the modern technology available to us to do it. Dr. Quacha?
Technology in dentistry is evolving on a daily basis. So now there is technology out there that can help us find cavities in between the teeth, but also on the biting surface of the teeth much earlier than we used to. One of the technologies that we use here at Dream Dental is called a Spectra Cavity Detector. Basically, it uses trans-illumination. It uses a light that scans the tooth. It fluoresces through the tooth structure and measures its density. So that way, if there's a soft spot hiding below the surface where we wouldn't necessarily be able to see or feel, we can find it much sooner, much earlier, and fill it while it's small.
So Dr. Quacha, what are some of the advantages to the patient of finding those cavities earlier?
The advantages of finding cavities while they're still small is that they haven't eaten away too much of the healthy tooth structure. So you can provide much more conservative dentistry, you can remove much less tooth structure and have much less pain, sensitivity, and overall much less cost in the end if you get a cavity while it's small, as opposed to waiting, watching, letting it grow.
Any statistics on how much better the Spectra Cavity Detector is, and I guess probably just as importantly, how accurate is it?
So you still want to do a visual exam. The traditional exam for finding cavities, specifically on the biting surface of a tooth, is to just poke at the little pits and scrape at the little pits to see if you get a soft spot, to see if you get a stick. However, with the extensive use of fluoride in our diets, in our water, in toothpaste, in rinses, the shell or enamel of the tooth can become quite hard. So sometimes there's a cavity hiding below the surface, but it's very difficult to see visually. You can't feel it. They usually don't show on an x-ray. So a lot of times using the Spectra Cavities Detector, this is the only way we can find some of these small cavities. It is FDA approved and it has been proven to be quite effective, and personally I have found it to be 100% accurate. I've never had a false positive with it. It's amazing technology.
Okay, Dr. Patrick Quacha of the Dream Dental Group, thanks for joining us today to talk to us about how we can find cavities in our kids earlier, and I suppose just as importantly, save a little bit of money as well. I'm Scott Gregg, thanks for watching.